I'm Dr. Elizabeth, and I will be telling you 7 important dietary tips for patients with chronic kidney disease. I'm Dr. Elizabeth Angelica Roasa, and I am a practicing nephrologist here in Manila, in the Philippines. I also teach at the University of Santo Tomas. I am a professor, and I am the chair of the Department of Physiology, and I also teach in internal medicine. I practice nephrology at the University of Santo Tomas Hospital, among others. I also see patients at St. Luke's Medical Center in Global City. Talk about salt. Number 2, protein. Number 3, potassium. Number 4, phosphorus. 5, calcium. 6, fluids. And 7, calories and nutrients that our body needs. It's very important for us to limit sodium in our body. Why? Sodium is closely related to blood pressure control. If you take too much sodium, then that can also contribute to hypertension, and hypertension can further damage our kidneys. The Asian diet is really loaded with sodium, whether it be Japanese or Chinese or even in Singapore. We have to also be very careful about eating the right amount of protein. We want to eat enough, but because we don't want to deplete our muscle stores. So you have to eat the right kind of protein in the right amounts, not too much, not too little. Large amounts of potassium are found in certain fruits and vegetables. Not all the fruits will have the same amount of potassium, but we must make special mention of bananas, melons, oranges, even the root crops. I said potatoes, kamote, we call it in the Philippines, ube. I'm not too familiar of how you would be calling these kinds of root crops, so we call them. Cassava is another. Tomatoes, dried fruits, nuts, avocados, and even some green leafy vegetables will have some potassium. We should take special care in the amount of juice that we take in, especially if you prepare them from fresh fruit. Because you squeeze one orange, it will only make half a glass of orange juice. So in order to make a full glass, which many of us want to drink in, so we make that our water, but you're taking in about 3 oranges already. So watch out for these fruits. Other food stuff that may contain potassium would be milk, yogurt, some dried beans, peas, as I said, salt substitutes. Protein-rich foods such as meat, poultry, pork, and fish will also contain some amount of potassium. So, among other things, these are the things that we have to watch out for. Fresh fruits, fruit juices, and root crops are the usual things that I would tell my patients. Why do we want to limit the potassium? As most patients with kidney failure will have a difficulty in removing excess potassium from the diet. And potassium can have ill effects on the function or the physiology of our muscles. And one of the important muscles of our body is our heart. So if you have too high potassium levels, that can cause cardiac arrhythmias or disturbances in the heart rate and heartbeat. Even our muscles can be adversely affected by very high or very low potassium levels. So we have to keep these potassium levels in mind. In the food we take in. We have to be aware of whether we have very high potassium levels or low levels. Phosphorus, it is found in many of the food stuff that we take in. And any excess in phosphorus will have to be removed from our body also through the kidneys. So when we have kidney failure, phosphorus levels can go high, and this can stimulate some the hormones, like from the parathyroid gland. It will cause the parathyroid hormone levels to go up because the role of this hormone is to try to help our body get rid of excess phosphorus. But since our kidneys are failing, our body cannot do that. So phosphorus tends to build up, and that will in turn affect the calcium levels. And when you have too high phosphorus levels, this can also affect our other soft tissues of the body, especially our blood vessels. So our blood vessels will become stiffened. We call that vascular calcification. So that is one important thing that we have to remember, because blood vessels, especially the blood vessels of our heart, when they calcify, when they become hard, they can lead to cardiovascular events and even cardiovascular death. Calcium, we have to watch the amounts of calcium that we take in. We don't want it to go too high or too low. Besides which, many of the foods that we take in that contain calcium, for example, dairy products, they will also contain protein. And I had mentioned earlier that we do not want to take in too much protein in our diet. We have to watch the amount of fluids that we take in, because when you have kidney failure, your kidneys may have some difficulty in removing excess water, and that can cause now a buildup of water in our systems. And that can be bad for us, because if it starts to build up in our lungs, that can compromise our ventilation, the amount of oxygen that we can take in. That will make your heart also start to fail. So fluids in conjunction with sodium now, I mentioned that in the beginning, are very important to balance. Now we have to also take in the proper amount of calories. Why? If we do not take enough calories, our body will try to look for energy sources elsewhere. No, it will start to break down our protein stores and our fat stores, and that will contribute now to wasting in our body. And we do not like our patients to become underweight. Many CKD patients or chronic kidney disease patients, they tend to become underweight, and we do not like that. We have to maintain almost ideal weights in these patients. Yes. When you talk about the diet, it will vary from individual to individual. Of course, each individual will have the right amount of calories to take in every day. And that will depend upon your height and your weight. So you will have to have a BMI, you have an ideal weight that you want to attain. And the amount of calories that you need is based on the ideal weight of an individual. Of course, we try to encourage patients based on lifestyle to have moderate physical activity, which means the equivalent of brisk walking, 30 to 40 minutes every day, 4 to 5 times a week. So that is the ideal physical activity that everybody should have. For all diseases for that matter, and especially the metabolic ones, diabetes, hypertension, kidney disease, obesity, we have to encourage lifestyle. You may take in all the medicines that the doctor prescribes to you in the, writes it down in the prescription paper. But if you do not follow basically lifestyle, that is fundamental, that's basic, paramount. And after you fulfill everything in the lifestyle, then that's time you will, rely on additional medications.